talk about the psychological effects of all that you've shared with us tonight.
Well, we spent some time talking about the traumatic effects of the brain and what it can do. And of course, a lot of people live with various different kind of emotional, psychological issues. I mean, we heard about ADD every day. People, with, anxiety, depression. It's very prevalent. And I think people are a lot more open to talking about it, which is actually a great thing. It's not a taboo anymore. So brain, the SPECT imaging really does look at function. So the functionality of the brain changes or is changed by the actual different psychological, emotional makeup of the person. So let's say you have depression or you have ADD. Certain parts of the brain, are in depression, let's say, are not functioning as well, or the areas that are not functioning should be is functioning too much. And sometimes with ADD, and often many areas of the brain that should be quiet are firing like crazy all the time and demanding huge amount of brain flow. So everything's going crazy. I hate to use that word, no pun intended. Everything's kind of going haywire. And so brain has really hard time controlling itself, and that's why people have difficult time focusing and focusing on a task. Other things like dementia, those are actually can be organic problems, or could be, lifestyle choices and the results of those kind of things. And depending on how the brain, the blood vessels are healthy, will change the brain flow to different areas. People who had substance abuse, alcoholism, drugs. I mean, now with marijuana becoming legalized in Colorado, I think there are a lot of young people now thinking marijuana is good and legal, so it can't be harmful. That's far from the truth. I mean, it's terrible. So you'll have that. I think we're going to go through the same kind of problems that we had with alcohol legalization, and kind of those behavioral modifications. But the brain will go through tremendous deficits as a result of abuse of alcohol and drugs, let alone things like methamphetamine or heroin and all those kind of drugs. And they have profound effects. If there's a chance to see some of those pictures, you'll see areas of the brain that are not healthy where literally there are holes where the brain is not getting the nutrient it needs to function, and that's why you have those kind of problems. So I think overall, apart from the traumatic brain issue, such as the NFL players, but there's a much larger picture what everybody lives with these days in terms of depression, their everyday anxiety, and how they interact with their coworkers and their family, and even among themselves. Those are psychological, emotional issues where I think the SPECT imaging really has a tremendous value, and being able to objectively see the different areas of function of the brain that are functioning well, not well, or functioning too much, and how they relate to the various problems that people have. And once we have that, as we talked about before, we have ways to treat and improve those kind of functionality through medications as well as supplements and other things to help them recover and become more normalized.
As we wrap it up here tonight, as you look back on your incredible career, which is far from over,
sure.
What is it that you cherish most about what you get a chance to be a part of every day?
Wow. I think the ability, hopefully, and the opportunity to really help people in various levels, from small to, hopefully some in a profound way. And the reason I went through all these different educations and things like that is not because of ADD. I think I maybe a little bit. But really for me, when I embark on something that I think is important, I really try to learn as much as I can and to gain as much knowledge and skill as possible before I try to do something for another person. And so that really, to have that type of opportunity and the privilege to work with patients of different types, and hopefully one day we can actually do some of these kind of things that we're thinking about right now, and to have that chance, I think that really is the best part of what I've been doing.
Well, this is only a 30-minute show, so we've got to wrap things up. But This has been most fascinating. I can sit here all night and listen to you.
Yes.
Thank you so much.
Thank you very much.
Dr. Doohi Lee, we really appreciate it. Well, that's it for this week's edition of Conversations for Brain Health and Dr. Lee. I'm Scott Murray. Until next week, have a great week, everybody.
You see the shows on TV, but have you ever wanted to be part of the law field in real life? Now you can. Kaplan College could train you to become a paralegal. You could help lawyers prepare for trials, interview witnesses, and handle case documents.